Thank you very much. Thank you very much, Aisha, for that feature on breast cancer awareness. I hope you learned one or two things from that feature. Now to discuss more about this topic, I have with me Dr. Ngupedo Imlaha. She'll be talking about breast cancer, and also a breast cancer survivor in the studio and talking about Maryam Atswandeh Salami. Welcome to your weekend. I'm happy to see you guys, and the fact that it's all women is even more interesting. Okay, now for starters, for those of us who don't know what breast cancer is, even though the feature is a background that they have told us a little bit about this, but want to hear from you, who is the medical personnel in this field, what breast cancer is, and how do they go about the diagnosis of breast cancer?
Okay. Cancer is the growth of abnormal cells in any part of the body. And when that growth happens in the breast, it's known as breast cancer. And how do we diagnose it? Firstly, by physical examination. So we tell people, check yourselves. If you find a lump, if you see any changes in your breast, if you see anything abnormal, present to a doctor immediately. And how do we diagnose this? By the use of mammogram. Mammography is a X-ray that is done to visualize the breast, and then we also have ultrasound. And then if we find lumps through any of these procedures, we go ahead and we do a biopsy. The biopsy is necessary because we need to take a piece of that mass and be sure what kind of breast cancer this is. And then for other cases, we can also use CT scans and MRIs, which let us know the extent of the spread of the breast cancer.
Wow. My major concern now is the awareness of this breast cancer. What is the level of awareness of breast cancer, especially here in Nigeria that we're talking about?
I would say it's still very low. The strides are being made, but if majority of the cases we have are still presenting in the advanced stages, then we can only say that the awareness is low. There's still a lot of people presenting at the late stages of breast cancer. We still have a lot of deaths from breast cancer, so we're not doing enough. Breast cancer is prevalent all over the world, but we want people to know about it so much that they come in early when treatment is much cheaper and when it's easier. When breast cancer is diagnosed at the first or second stage, 90% of those people go ahead to survive. Okay. So we want breast cancer to be so common that everybody knows about it, from our schools to our communities to our churches and to our mosques. And we are doing the work, and I'm glad for this program as well. Thank you.
Okay, so from what I got from what you just said, so you said if early detection, 90% of those cases can be handled successfully. So when do you think is advisable? Can I just, even though I don't notice anything on my body, maybe my breast, there's no lump, there's no growth, but I just want to come in to check, is it advisable?
So we say that for the physical examination or for the self-breast examinations, we advise ladies, men, once a month, at least once a month, after the completion of your period, stand in front of your mirror, examine your breast, take a look at it. Has the color changed? Has the size changed? Has the shape changed? Check your breast, check your armpit. Is there something different that wasn't there before? Okay. And then from the age
I need to come in there because with that examination, even self-examination, there should be some form of education about it. Because what am I examining if I don't know? I don't know anything. I'm just standing, I'm just looking at my body and it's still the same. So I still feel there should be a level of information passed down to people, maybe through pamphlet, through programs, through jingles or anything, just to let the girl child know that this is how your normal breast is supposed to look like. And when you notice that it's not looking this way, then you know that something is going. So I'm still feeling that. That's why I was asking the level of awareness. There should be just this basic education that a girl child needs to understand to know that there are changes in her breast.
Yes. So a lot of those programs are going on through private-public partnerships. We're going into the schools. We're having school outreaches. We're telling girls who have reached the age of puberty, as long as you have a breast, every month, stand in front of your mirror. We have these demonstrations, we take the We have our trained nurses and our trained doctors who stand in front of the girls, and we teach them step by step how to examine yourself in front of the mirrors. And then even in our public health facilities, we're reaching out to our women and to our mothers who come in for immunizing their children, for example. We're saying it doesn't matter at any stage at all. We are reaching women through the communities. We have a lot of religious leaders and community leaders who are also on board. We've had very successful programs at Medicaid Cancer Foundation in Kebbi, for example, and even in rural areas.
Okay, I was asking about taking this information down to the grassroots level, the rural area and women, but I will speak to Maryam, who is like our champion in the studio right now. She is a breast cancer survivor, and we want to know how it has been for you, right from when you were diagnosed with that, the challenges you faced, and how did you pull through? Yeah, I know. It's really a wild thing, but let me give you that time to just digest it and give us our response.
Yeah, it's from diagnosis to now, it's been God and early action.
Wow.
It was one of the toughest phases of my life.
I can imagine.
And somehow, with support, family, friends, colleagues, and well-wishers, I was able to pull through. I was able to do my treatment early, because one thing is a different thing to diagnose, and it's another thing to actually go for your treatment.
Accept.
A lot of people even run away from the hospital after diagnosis because lack of funds is a major thing for them. When you go to the grassroots, an average Nigerian cannot even afford to have their treatment complete. You'll be spending like 25 million. For someone like me, I was diagnosed with triple positive. So that means there are some target therapy I have to undergo. One of my injections was more than my house rent in a year. And I was taking that every 3 weeks.
Wow.
So you can imagine the pressure. I remember the first day I was told in my second hospital that they gave me the receipt of my medication, over ₦1 million for a chemo. I ran out of my doctor's office, like, it can't be me. I went to the ward and I was like, please, is everybody here going to take this same thing? And I was, my doctor calmed me down and asked me questions. Are you on NHIS? Are you on this? Even after on NHIS, registering on CAP and all that, I was still paying over 600k every 3 weeks for treatment. So I had to somehow start speaking. I had to somehow start asking people, please help me. I need your money to stay alive. And a lot of people just want to die in silence because they know that they don't have where to get the fund. It's not all families that can stand with their own. There are a lot of people I have lost because their family did not stand with them. Communities, we actually need to do better, but I'm sure we'll come to that.
Yes, because I was going to ask how this has changed your perspective, and perception towards life, with what you've gone through. Because I really want you to use this story to motivate other women out there who think having this. I know it's quite expensive, but it's not really a death sentence. Like we said, early detection can actually curb this for women who are diagnosed with breast cancer.
Detecting it early is just the best. And a lot of people don't really know, like what you said before. We need to pass basic knowledge. We need to pass it down to the younger ones. If our younger ones, if they are aware, it will help them to detect early and also have their treatment. Somehow it has actually changed everything for me, both physical or spiritual. It has changed. It moved me closer to God. Somehow it gave me a new voice I never had. Confidence that I never had. Ordinarily, I won't be sitting here with you. But somehow, when I began to talk to people, I realized that, a lot of women actually need survivors to pull through. You understand? If you go to the hospital, you will understand what I'm trying to say. A lot of people have given up before time, but
All right, I'll come to you for because time is always against us when there's something interesting happening. I'll come to you to give maybe a word of advice to women who are going through what you went through. But let me speak to the doctor in the house. Okay. Now, let's talk about lifestyle, hereditary, genetics, and all, because they say all this. If you have it in your family, be rest assured that some years time or something, you will surely go through that process. How true is this? And then how can one change that perception, of the breast cancer in terms of lifestyle, hereditary, and genetics?
Okay, so I'll start with the genetics, and for that I have to say two things. So if someone's mom, sister, or father in the family has had breast cancer, that can double their risk of getting breast cancer. And the second most important thing is that 90% of all breast cancer cases are sporadic. Sporadic means that nobody in their family had it.
Oh,
exactly.
Okay.
So
that debunks really the family.
No. Yes, you would have an increased risk, but lifestyle plays a key role. The majority of people who had breast cancer, nobody in their family ever had it. It just came up. So lifestyle plays a key factor. Someone's mom may have had it, but if they live well, for example, that could reduce their chances. Okay? And when we talk about lifestyle, what do we mean? For example, alcohol, for example. There is no safe amount of alcohol. Previously, we thought that, okay, maybe you can drink a glass of red wine.
But they say you should take a glass of red wine. Keeps the doctor away. Okay, alcohol.
To our listeners, there is no safe amount of alcohol.
Oh, God. Okay.
Proven risk factor. Another one is being female. Yes, more just because you're a woman, that increases your risk compared
Am I supposed
to
to
the
change
men.
my mood? The
men have their issues.
Okay.
But in breast cancer, this is it. And then, of course, age. From the age of 40 and above, you're at increased risk. That's why we say start screening for that. You get your mammogram every year. Another risk we know is a sedentary lifestyle. Okay, people who are overweight. Especially after menopause, and people who do not exercise
at all.
Yes, exercise can decrease your risk of a lot of cancers. And then another one is the use of hormones. Okay, for ladies in menopause, for example, who have to use hormonal therapy and
all the hormonal supplements,
some
and drugs.
hormonal contraceptives like the oral contraceptive pill can increase one's risk of. And so these are lifestyle factors that we have control over. Smoking as well.
Okay. But what do you think are the general misconceptions about breast cancer that you wish people will understand more? Because I know, like I said, if you're just given this result that this is it, it's not like a death sentence. But what are the general misconceptions people have about this?
The very first one is that it's not a death sentence. Yes, it's not at all. We have improved therapies, improved ways to fight breast cancer. So, and because of that, some people shy away from screening. They're like, oh no, they don't want to know they have it. No, if you don't know you have it, that just worsens your condition. So present for your screening so that the sooner we get it, the sooner we can take care of it. It will be cheaper and it will be faster to treat it. Another one is that people think men do not get breast cancer.
Yeah, because I was asking that. I saw a research where they say rarely, but it's not like they don't. So men also do have breast cancer.
Men do have 1 out of 100 men.
Okay.
Do have breast cancer. So men do also get breast cancer. And we already spoke about the genetics.
Yeah.
People will say that, oh no, we don't have cancer in my family. No, it's not about in your family. A lot of people who have cancer now are the first people in their families who ever had cancer. So go for your screenings and present to the doctor if you have any problem. If you notice any abnormality, go and get checked. And
all right, thank you so much. I know my director is already telling me that time is up, but I still need to hear from Maryam. So what advice, being a breast cancer survivor, would you have women out there who are going through the same thing that you successfully passed through?
I'll just tell them that early detection saves lives. The thing is, it is hard, but it is doable. and they need to keep speaking. Nobody should die in silence.
That's
when
true.
you come together, you speak, you will find somebody that will help you. So don't die in silence. Ignorance is seriously it is.
Thank you so much, Maryam, Dr.
You're
Wim, for joining us on your weekend and, giving us more details about breast cancer and all. Up next on your weekend, we go for our lifestyle segment, and it's titled Style and